Hello, everyone. My name is Mauricio Dankers. I'm the current chair of the LGBTQ plus interest group, part of the CHESS community. The LGBTQ plus interest group is a group that brings together clinicians and allies who are committed to advancing inclusive care and creating a space where everyone in CHESS medicine can thrive. It's about connection, advocacy, and making sure LGBTQ plus patients and professionals are seen, supported, and valued. Thank you for joining us today to launch this very meaningful new journey, the CHESS LGBTQ plus webinar series. We are thrilled to open this series during Pride Month, a time to celebrate identity, visibility, and the ongoing pursuit of equity, with our inaugural session titled Healing Under Pressure Advances LGBTQ plus Inclusion in Uncertain Times. This series is part of a commitment to amplify voices, share lived experiences, and equip one another with tools to lead with compassion, courage, and purpose. Thank you for being here. We are honored to have you with us at the start of something powerful.
Hello, everybody. My name is Adam Moore. I am the vice chair for the LGBTQ plus interest group at CHESS. And first and foremost, I wanted to say happy Pride to everybody. And thank you for joining us for this very important topic. We are a group at CHESS that are committed to advancing the health and ideals that make this community very important, and we stand in solidarity with everybody in the LGBTQ community. So in that process, we have asked Alex Sheldon to join us to give us one of these webinars, and so I will go ahead and very proudly introduce Alex. So Alex Sheldon is the Executive Director of the LGMA and a professional research strategist and advocate with over 15 years of experience in the field of human rights, with the concentration in LGBTQ rights. And prior to joining GLMA, Alex was the head of research and social impact at an LGBTQ plus startup company, where they specialized in economic inclusion for LGBTQ plus people. Previously, Alex served as the deputy director at the Clinton Global Initiative from the Clinton Foundation, and held roles at Everytown for Gun Safety, the Movement Advancement Project, and several international nonprofits. They received an MA in International Human Rights with a concentration in Global Health Affairs from the University of Denver, a BA in Psychology from Whittier College in California, and a certificate in Nonprofit Leadership and Management from the Institute for Nonprofit Practice. Alex is also a returned Peace Corps volunteer and currently serves on the board of directors at the Equity Federation. Alex, we are so proud to have you here. We welcome you and thank you so much for taking the time. Please take it away. We are so eager to hear what you have to share.
Great. Thank you so much, Adam. I really appreciate it. And it's always a good reminder that I need to shorten my bio, but I really appreciate that and really appreciate the warm welcome, y'all. I'm excited to be able to chat with you. Of course, this Pride Month hasn't gone exactly how we all expected, or maybe it has, but I'm really, really honored to be able to talk to you all about how we can fight back and make sure that we are healing under pressure and advancing LGBTQ plus inclusion, even when the times are a little bit uncertain and when some policies that are being put forth at the federal level and even at the state level aren't exactly as welcoming or affirming of LGBTQ plus populations. So I will dive in here, and we have, at the end, we'll definitely have time for questions, but you can also reach us by chat. So if you have an urgent question that you would like to pause and like me to answer right away, just please feel free to drop that in the chat and I'm happy to get to it. But so today, as I mentioned, we'll be talking about advancing LGBTQ plus inclusion in uncertain times. And these are absolutely some of the most uncertain times, I'm sure, in most folks' history in their clinical practice or in their education. We know that policies are changing every single day and often then being challenged in court through litigative battles. And therefore, we're really unsure how to navigate these things. But there's always things that you can do and little choice points that you have to make clinical care and make research and make all aspects of healthcare more inclusive of LGBTQ plus identities. So first, before I dive in a little bit more about GLMA, we are formerly known as GLMA, or the Gay and Lesbian Medical Association. We've been around for over 40 years, and we're the oldest and largest association of LGBTQ plus and allied health professionals working to advance LGBTQ plus health equity. So we have thousands of members nationwide, all folks who are engaged in using their own expertise and their own lived experience in some cases to advance LGBTQ plus health equity through research, education, and advocacy. So today we're going to be going through three main areas. First, we're going to be talking about the LGBTQ plus policy landscape, then how that directly relates to our understanding of LGBTQ plus health disparities, and then we're going to close out and talking about how to build more inclusive clinical environments. So first, with the LGBTQ plus policy landscape, oftentimes when people talk about LGBTQ plus policies, people sometimes think about the first area of law that they think about is marriage. And sometimes they may think about workplace discrimination or maybe adoption or HIV criminalization or policies. But the reality is there are over 50 areas of law and policy that govern our livelihoods throughout our lifespan. I'm going to focus on one specific area to demonstrate the political environment we live in right now, but I'm going to take us through an overview of what we are talking about when we're talking about LGBT and transgender, non-binary equality across the board. So when we talk about these 50 different areas of law and policy, the Movement Advancement Project, where I used to work and also helped develop some of these maps, has taken all of those policies and created what we call equality tallies. So by looking at this map, you can see from at the state level, so all of these laws, many of these laws exist at the state level, and each of these states has been scored based on their relative inclusion and affirmation of LGBTQ plus lives. Essentially, how easy or how difficult is it to live in this state as an LGBTQ plus person? So usually I show these two maps side by side, but it's really important to note right now that this is the map of all policies that relate to LGBT identities, so sexual orientation specific. And you can see that we have quite a few states that are in the high equality tally, almost 15 of them, including DC. And then the green, the lighter green is a medium equality tally, and so on and so forth. And then we get down to the negative states, of which there are only a handful. But when I click on state level policies that pertain to transgender identities, we see a completely different picture. That means that almost half of the country has laws that are incredibly hostile to trans and non-binary people. That might include limitations on whether or not you can update your identity documents to match your lived gender expression, or it could include insurance denials that are allowed at any level. And it also could include essentially permission for any workplace to fire someone simply for being trans or non-binary. So this is a showcase of, again, looking back and forth between sexual orientation and gender identity, where one state might be a little bit more friendly to LGBT people. It could be a completely different environment for trans and non-binary people. So one of the things that we want to show here too is that these state laws have actually gotten worse, in that, like, we have generally over the last few years been on a steady trajectory of more inclusion and better laws that actually protect families of LGBTQ plus and LGBTQ plus people. But this is without a doubt the most hostile political environment the LGBTQ plus community has seen in decades. And unfortunately, our opposition, and I can talk a little bit about who our opposition is a little bit later, but those are the folks mainly who are behind Project 2025 and a few of the other regressive policies that are really driving a wedge between patients and providers in healthcare and really trafficking in mis and disinformation in order to make sure that they can attain more power and not actually promote health. So our opposition is really succeeding in a lot of instances and mainly trying to attack LGBTQ plus folks as well as attacking trans folks in order to push their own political agenda. So these attacks have been incredibly broad in scope. They have touched HIV prevention and treatment, rural health, care for older adults, vaccines, abortion rights, and so much more. But again, I'm going to focus in on one area of health where the attacks have been particularly widespread and unfortunately very successful. So once again, looking at the trajectory over the last few years, these are the number of anti-trans bills that have been introduced at the state level year over year. So you see in 2015, only 21 anti-trans bills were introduced. So far in 2025, nearly 900 bills targeting the transgender community have been introduced in state legislatures across the country. So we say this is the most hostile political environment in decades. We really mean that. That means, and also this means that mostly half of the states that are passing these laws are doing so in such rapid succession, targeting bathroom access, sports, healthcare, education, and other areas that govern our livelihoods. And then specifically, LGBTQ plus healthcare, but in specific, trans healthcare has been a target in order and putting limitations on access to healthcare for trans and non-binary minors is a particular target area of our opposition in this case. So this is essentially a war on bodily autonomy. And when we are not able to make decisions about our own bodies, or when providers aren't able to make the decisions about someone's healthcare with them, and actually the government is interfering, that is an attack on healthcare overall. But we can see that since last year, and of course since 2018, the number of bills is just proliferated at a wildly alarming rate. And just last year, 189 bills were introduced throughout the country to attack trans healthcare. And that has left us with this patchwork of protection and patchwork of laws. So bans on trans healthcare for minors have passed in 27 states. Those are the maroon and orange states there. These are bans that have caused hundreds of thousands of trans and non-binary young people to lose access to critical care. And once again, this care, gender-affirming care for trans and non-binary minors, is supported by every major medical association out there. It is supported by decades of medical evidence and also has well-established standards of care that have been put in practice for many decades as well. The most important piece that I like to note about these bans on trans medical care for minors is it doesn't actually outlaw the care for cisgender minors. So if you are prescribing puberty pausers for someone who is undergoing like precocious puberty, that remains perfectly legal under these state bans. The only people who are not able to access this care are trans and non-binary young people, which we know means, and many courts have sided with us in this, that means that this isn't about the care itself. It's not about its safety or efficacy. It is about targeting one specific, very, very small community. So now I want to move over into the federal landscape, which of course we know that the current federal administration has targeted the LGBTQ plus community in a sweeping number of executive orders and other actions. So this is actually a fairly limited list of the ways in which this administration has targeted our community. And I'm not going to go through what each of them outlined or some of the repercussions of these, but the most important piece to take from this is that executive orders are not policy. They have impact on the policy space, but they're essentially wish lists from the federal government. So when we were, for instance, in January, when they put forth the Protecting Children from Chemical and Surgical Mutilation, this was an executive order that was aiming to condition funding, federal funding for any healthcare setting that provides gender-affirming care, and conditioning it so that you were able to do so if you provided gender-affirming care to anyone under the age of 19. This was a sweeping, very dangerous executive order that was put forth by the Trump administration. And also, it basically said, if you do provide care to even one young person under the age of 19 for the purpose of gender affirming care, then you could lose all of your Medicaid funding, all of your research funding from the federal government. And the most important piece that we heard from people is that many healthcare settings decided to obey preliminarily. Like they decided that they were going to overly comply right away, not knowing that this was actually not federal policy that was put forth. In fact, federal policy as it stands today still protects trans and non-binary people from discrimination in healthcare settings under the Affordable Care Act. So by pausing or ceasing gender-affirming care for trans and non-binary people, these healthcare institutions were actually violating federal law in trying to abide by this executive order that came down. All right, so this is what has happened since this executive order was put forth is we saw a number of institutions that had provided gender affirming care go offline or stop providing that care, or pausing that care. After we filed a lawsuit against this executive order with co-plaintiffs at PFLAG, and we were represented by the ACLU and Lambda Legal, we did get a preliminary injunction in this case, which meant that most of those institutions went back online to provide that care. But now we've also seen some escalations, particularly from the Department of Justice and a few other government agencies, and the ways in which they are trying to weaponize their agencies in order to go after folks who provide this care. So once again, I would love to do a deep dive, and I usually have presentations that are purely about policy, but I know that I want to get to some more solutions. So what we're trying to do is just paint a picture here of how incredibly hostile this environment is. And I guess you all probably didn't see this page before for too long, but this is still just a short list of some of the ways in which our community has been targeted and also just simply been dehumanized by the federal government. That also includes things like defending women from gender ideology, or their attempts, in other words, to define gender and sex as immutable characteristics that are only man and woman. So, and then also many of our members, and I'm sure many folks here perhaps, were impacted by the massive termination of NIH grants related to DEI, related to HIV, LGBTQ plus identities. This is another area in which we filed a lawsuit directly against the NIH for that mass termination, and hopefully we'll be getting a ruling soon. Although another case that was brought by the APHA and other folks in the space, we did get a good ruling in that case, and they said that the mass termination of grants related to DEI were illegal, and so much of that funding will be restored. So the reason we will go through that entire landscape and talk about the policies that are impacting our livelihoods is because it has direct impact on LGBTQ plus health, both behavioral health and physical health, because living in a hostile environment is not an easy thing to do. When you're especially for young LGBTQ plus people, you're constantly getting messages that the federal government or state level governments or your policymakers, the people that your parents and friends and family members voted for, don't believe that you deserve access to healthcare, or don't believe that you should be able to get to play on the right sports team that actually coincides with your gender identity, or that you don't deserve to have any of your healthcare studied. Those are messages that people internalize, and it's living in this area, this world of stigma, discrimination, and fear that has real tangible health outcomes. So here's a little overview of understanding our LGBTQ plus health disparities. We know that LGBTQ plus people report higher rates of depression and anxiety. We know that LGBTQ plus people also experience higher rates of suicidality, and LGBTQ plus youth are 2 to 3 times more likely to attempt suicide. And we know that LGBTQ plus folks report higher rates of tobacco, alcohol, and substance use disorders. In the physical health disparities, we know LGBTQ plus people are more likely to be in fair or poor health compared to non-LGBTQ plus people, despite being a younger population overall. So this means that they're just reporting that my health is fair or poor, and they're more likely to do so than our non-LGBTQ plus peers. Also, LGBTQ plus people experience higher rates of heart disease, asthma, and specific cancers. And also, HIV still disproportionately affects our community, particularly gay and bisexual men, trans women, and communities of color. And importantly, and this is one of the most important slides that we can talk about in terms of health disparities, is these are not driven by any sort of innate qualities or characteristics of LGBTQ plus people. This is directly related to stigma, discrimination, barriers to care, and social determinants. So in barriers to care, we know from survey data that 1 in 3 LGBTQ plus patients have reported discrimination in healthcare settings. And we know that that often leads to folks not actually going back to receive care. That means that they will delay care or just refuse to go get any sort of preventive medicine or actually access any sort of healthcare because they're worried about further discrimination or further stigma. We also know that many providers receive little to no formal training on LGBTQ plus health, and that leads to things like misgendering, incorrect assumptions, or even refusals of care. And we also know, as I mentioned in some of the maps related to policy, that insurance exclusions are still legal in nearly half of the country, meaning that you can actually be, as a trans or non-binary person, your coverage could exclude gender affirming care, fertility services, or even routine procedures simply because of your LGBTQ plus identity. And then there are also social determinants of health that have led to other health, LGBTQ plus health disparities. We know that LGBTQ plus youth make up a incredibly disproportionate amount of youth who are experiencing homelessness or who are unhoused. We also know in many states, stigma and discrimination, it runs rampant. And in many states, you can still be denied housing, healthcare, or even work because of your LGBTQ plus identity. And also LGBTQ plus people, and in particular, trans and bisexual people experience higher rates of interpersonal and intimate partner violence, as well as threats of violence. So when we think about LGBTQ plus health equity, all of these things contribute to health equity. So we're talking about social determinants, access to care, housing and food security, abortion rights, HIV treatment, and rural access as well. So this is an overarching area, this is the overarching picture of what contributes to LGBTQ plus health equity. It's not simply the things that we have thought about in the past of LGBTQ plus health. It really consists of like your whole well-being and livelihoods. So now, building inclusive environments. One of the things and why GLMA exists, and one of the things that I really love about being able to train in this area is that being a health professional right now is not just limited to the kind of care you provide or the type of research you do, the type of patients that you work with. Being a health professional carries such a significance right now in this political environment. We know that health professionals, on average, are trusted an incredible amount in their communities, in their workplaces, in the media. And so it is really incumbent on health professionals throughout the country right now to use their voice to advocate for change. So whenever we talk about policies and things that are impacting health, we always want to think about these spheres of influence. So it's a very important facet to be thinking about if you're thinking about creating more inclusive environments, is to think about all of the different environments that you actually work in. So as a health professional, I know you're likely concentrated a lot on making an inclusive environment in your healthcare institution, and that I will get to shortly. But there are several other spheres of influence that are really important ways in which you can use your expertise to drive impact and systemic change. So if you're trying to make change within your healthcare setting, we know that you likely want to be building power among your colleagues, but you can also be thinking about how you can make change even at your dinner table, or how you can make change at the state level systems like your state medical board or state legislature or state judiciary. So I'm going to run through these rather quickly so we can make sure that we get to enough question time. But here are some of the examples that we have sourced from our own members of how they personally have tips and tricks of how they have made a difference in each one of these spheres of influence. So here in patients, with family, community, and patients and clients, so the people who are closest to you, making sure that you're having difficult conversations about your areas of expertise and really driving out the mis and disinformation that has created this hostile political environment. Then, in thinking about your own healthcare institutions, these can be tactics that you can use here are, finding champions and allies within your organization, building cross-departmental coalitions and relationships, and also making sure that you have a direct line to your leadership and board members and other folks who are real change makers and decision makers. Also, one particular example that I've heard from one of our members that I really loved is tying your advocacy always to the mission of your organization. So many healthcare settings have a stated mission. I had one health professional in our network who said that when she was going to them to talk about why they were ceasing gender affirming care, she literally made a slide of the institution's mission and put it up on the wall so that everyone could see, are we actually advancing health equity? Are we actually reaching the hardest to reach populations? Those were important pieces of their mission if we are denying care to trans and non-binary young people. And it was just an incredibly persuasive argument. And I love that folks are able to actually tie it to the overarching mission. Also, making change in health professional associations can be an incredibly powerful policy or practice change driver. So at GLMA, we are the only LGBTQ plus organization with a voting seat in the American Medical Association's House of Delegates. That means that we get to put forth policies and resolutions that are voted on by the entire House of Delegates and really become the policy voice of the AMA. And it's really important for health professionals in many circumstances that are able to, if they're able to attain leadership positions within those institutions, or they're able to propose resolutions, you can actually really progress change from the inside. And this is another area of training that we provide at GLMA as well, is how to get involved in state level systems change. So whether it's testifying at a state legislative hearing or in a committee hearing of the state legislature, or if it's meeting with state legislators to share expertise, or joining and supporting state level coalitions, or joining your state level medical board, serving as a witness in court cases. These are all ways in which we provide training in order for folks to use their own personal expertise to drive change in these areas. And these are really important pieces too right now, as we are seeing a lot of the Department of Justice currently is being weaponized in order to target gender affirming care providers throughout the country. And they will likely try to be working with state medical boards in order to, rescind licenses in these spaces. So working and being a part of state medical boards can be a really great protective factor in order to make sure that the government isn't overreaching into the practice of medicine. And lastly, on these spheres of influence, we have federal level systems. Similar to state level systems, there are all these governing bodies that you can use your expertise to drive change in. Again, that would be meeting with your members of Congress or their staff. That would be providing, serving as an expert witness in congressional hearings, joining national coalitions, and then also in government, like regulatory affairs. Right now, of course, they have closed public comment on many, many areas of regulation, but typically when a proposed regulation is up, they put it forth public comment periods. You can go to the federal registrar and submit your comments as either through your lived experience or your work with your patients. And it is very important to utilize those public comment periods in order to drive change. Not only does it actually influence the decision often of the governmental agency, but if we don't get a good decision, it actually lays the groundwork for further litigative efforts to overturn it. So it's very important to actually make sure that our voices are heard in those public comment periods. And that's another area in which, if you, that GLMA puts out those opportunities and sends it out as action alerts to all of our members. So back to building an inclusive environment in an actual healthcare institution. There are a number of ways to do this, but the first point is always that first impressions really matter. Whether it is your security guard who is working directly outside of the institution, or it is someone at your front desk, or it is anyone who touches the healthcare system and that is actually going to face patients or clients at any time, is a part of that first impression. And like I said before, because of the vast amount of stigma and discrimination that LGBTQ plus people experience and also experience in healthcare, the first impression could really determine whether or not they even go forth with an appointment, or they go forth with care and treatment, or it could mean whether or not they actually return. Bad or harmful experiences in healthcare settings is the number one reason why people delay or deny themselves care. And then the other biggest reason are because of financial resources. So here are a few ways to make a really good first impression and to also help to retain and make LGBTQ plus patients and clients feel more welcome in your environments. First, using chosen names and pronouns. This can be done, of course, and you'll see here, creating and using inclusive intake forms, but using those chosen names and pronouns from everything from check-in throughout the course of any visit or any time that you're working with a patient or client. Also making sure that you incorporate psychosocial, material needs, and social determinants of health in your conversation with folks. To really understand an LGBTQ plus person's experience in healthcare, you can't just look at exactly what they are, where and how they're presenting in that moment, taking into consideration the entire context and political context right now is very important. Many LGBTQ plus people are experiencing heightened depression, heightened anxiety simply because of this political environment. And that is particularly true for LGBTQ plus youth. Also, another piece, because this is an area of healthcare and this is a population that is constantly evolving and changing, is to make sure that your institution and each individual practitioner is accessing provider education. And I'll get to a little bit on our educational offerings at GLMA, but it's really important to make sure, because we know that LGBTQ plus health education isn't mandated in many health professional schools, but it's really important to make sure that you're keeping up with all of the ways in which the healthcare system can work better with LGBTQ plus folks and promote that cultural competency. Also, using LGBTQ plus inclusive images, including, the typical rainbows or other LGBTQ plus inclusive flags, and using those images on educational materials, brochures, websites, and even on your physical person. Wearing a pin that identifies you as a member of the community or an ally can actually make a really big difference in trust that we all know is very important in establishing between a patient and provider. Also, ensuring access to gender-neutral or inclusive bathrooms and hiring LGBTQ plus identified staff. Again, being able to see someone who looks like you, who represents your community, is often another way in which you can establish trust. Creating and using inclusive intake forms that includes asking for someone's gender identity as opposed to just asking what their sex assigned at birth is, though we know both are very important when it comes to clinical care for different dynamics, but making sure that you make room not just for identifying someone's sex assigned at birth, but also how they live and present themselves and what gender they use all of the time is a really important inclusion part. And then also creating and posting the existence of non-discrimination, diversity policies, and confidentiality policies around the clinic. Those are also very important trust-building aspects so that the folks know exactly what sort of policies and areas of care are being offered there. So at GLMA, one of the ways in which you can get involved is to actually work is to avail yourselves to some of our educational opportunities. So this year will be our 43rd annual conference on LGBTQ plus health. It will take place October 9th through 11th in Minneapolis, Minnesota. It will be our biggest conference to date. Last year was our biggest conference at that point, and we are already anticipating a much larger audience this year. We have about 800 health professionals who join us for the conference to learn any manner of the different areas of healthcare, emergent research, as well as also personal and professional development opportunities for our folks. And then lastly, as a member of GLMA, if you sign up as a member at glma.org, you can have access to on-demand, almost unlimited LGBTQ plus and BIPOC specific cultural competency training online, and it's all CME and CE. And I should also mention for our conference, we are accredited CME provider, and we typically offer about 30 hours of CME for our conference. And then on demand, you can also access all of that and also test your own cultural competency through that platform as well. And that is free to all of our members. And our members also enjoy a discount on our conference attendance. So that is everything that I have today, but I wanted to leave plenty of time for questions so we can talk through what it means to create an inclusive environment, so we can talk a little bit about y'all's experience and also hear from some of the folks on the steering committee here.
Alex, you did have a question. I'm going to make it live so you can see it. A question came from Carrie. It says, do we think it is effective to boycott conferences and societal activities in these inequitable states? Asking as an ally from Canada, debating American Thoracic Society conference in Orlando next year. ATNS is amazing, but I don't want to support going anywhere endorsing this inequity and oppression. Thanks.
Yeah, Carrie, that's a great question. And it's honestly a question that I get a lot. We held our conference last year in Charlotte, North Carolina, and there aren't as many friendly policies in the state of North Carolina as maybe some of our neighboring states. And my answer to this is a little bit nuanced. So I would say that it depends on what the local advocates say, if you're talking from state to state, because it isn't actually equitable to have everyone travel to the most progressive and inclusive states every time. So we have health professionals who live in North Carolina. There's a notable difference between cost of living and cost of hotel rooms and cost of going and attending a conference in San Francisco, California versus Charlotte, North Carolina. So if we are expecting all health professionals our audience to only travel to these most progressive spaces, we are actually then privileging the people who already live there and enjoy the privileges of living and working in a progressive state. So it is a real disadvantage for folks who have a lower cost of living and have to pay more to get to these places and attend. So there are some exceptions here. There are 2 states that, of course, like their attorneys general have really weaponized their own state level justice systems in order to target health professionals and arrest them or subject them to incredible government overreach and investigations. And those include Florida and Texas. So what I always say and what our policy at our organization is we will not go to a place where the local LGBTQ plus or the local NAACP has said, do not come here. Florida and Texas are the only 2 states who have done that. It is dangerous. It zaps the resources of the local advocates. And it does in many ways, in some ways, endorse inequity and oppression. But all the other states in my mind are fair game at this point, as long as, and that again, I think has to include, if you are in a less friendly state, a significant heightened investment in security. So for the first time ever last year, since we were in North Carolina, we hired around the clock security, and we were incredibly strict with our badge protocols. You couldn't get in anywhere without a badge. And that was very, very purposeful. And then the last note that I would say there is if there are any credible and notable threats made against individuals, then that is another reason to maybe pause whether or not to go there. We did not receive any such threats in North Carolina, but we had related to our cases in Texas and Missouri, and therefore those 2 states were off of the possibility list.
See, Jamil, colleague at ATS has his hand up, so I imagine Jamil wants to jump in and provide some staff context.
I was just going to add this context that, I am representing ATS, and, we all fighting for the same things. We all want the same things. And I will be remiss not to say, like, we're having our conference in Orlando, which has caused a lot of conversations prior to me starting at ATS and current. What I would say is, you answered everything the same way I would, where I don't want it to come across as if when we come there, even though we know that there's a lot happening, that we're not actually listening to our local members. So a lot of what we do, and I could just talk from us, just to give a little context, is that we work with our local members, just like we have in the past, like we just did in San Francisco. We're continuously working with them. So we don't do things to put people in danger. Mm-hmm. We do things to help uplift those that are there. And that's the best way to describe that.
Yeah, it's a good point too. And also, I think one thing that, you obviously are part of conference planning. What most folks also don't recognize, we plan a conference every single year, is you often have booked that place years in advance. And you can't get refunds for that. And so these aren't decisions that can be made or reversed like on a dime. It's just something to consider for the future as well. But I also know, like, we've spent a lot of time talking to our members about that fact. Like, they think that when we announce it, that's maybe when we booked. Like, in reality, we've signed that contract maybe a year or 2 prior.
While folks are thinking about additional questions, Alex, I can ask you something that kind of has come up before in our LGBTQ steering committee meetings, or just, it's something I've heard from some of our members, which is, right now, especially in states that a lot of, the anti-DEI, anti-LGBTQ sentiment is strong. How can folks be good allies to their colleagues? Like, what are the things they can do or say, in a place where it might be really difficult right now? That's just, I think everybody wants to do something, and there's not always a clear avenue for what do we do for our colleagues in healthcare systems. So wondering if you can provide some tips on that.
Yeah, Liz, that's a great question. And honestly, most of my answer is going to be really similar to what to do to be a more inclusive environment for patients and clients, because it is really taking into account the political environment and how that could impact someone and how they're showing up at work, how they're showing up at home, and really making space for that. One question that we often get is how to help someone who, a trans or non-binary colleague who maybe is being like misgendered in the space. And I always like point to, like, just establishing open, avenues of conversation, really making it very clear that you are an ally in the space, that you are someone who can be relied on, and really just after opening up those conversations, really asking them what they need. In the instance of maybe being misgendered at work, I think that that's a space where not everybody wants someone else to correct someone, but some people do. And that will all come down to individual preference. And similar, that is very similar for almost every single aspect of showing up as an ally in the workplace, is really understanding like how each individual wants to be affirmed, to how that individual may look for more support. And all of those are ways in which like it just depends on building that relationship first and really making it obvious that you're an ally. The other thing is also to really make sure that folks are, speaking to leadership in a way that is not just always relying on the people who have these identities, really relying on them to do their own advocacy all of the time in those spaces. And it's really important to be able to like make sure before things happen that you've galvanized support, that you've created coalitions, that you've established those relationships so you can be someone who's trusted. Because building that power is what's really important to make sure that like when things do happen or when something arises, that you're someone that people can go to. And not just relying on the people who occupy those identities to be always the ones on the front line, because they are already more likely to be targeted for discrimination, for things like that. So it's important to make sure that you are there as a supportive ally.
Alex, thank you so much again for really taking the time and providing this perspective, education, and empowerment of information. I do have a question that's kind of a little bit skewed, but what I've noticed is a lot of the agendas that we are facing as we try to lift up the community is we deal with a lot of hypocrisy from the people that are targeting all of these bills and all of these thoughts, right? And so I'm wondering, do you know of a repository of information or anybody who's doing work that shows that gender affirming care, for example, also affects the heterosexual non-LGBTQ community, right? So for example, the funding that goes into Viagra and Cialis, or the danger still that we see with breast augmentation surgeries for heterosexual women. It's very easy to target what gender affirmed care is, but the umbrella really is a lot larger. We're cherry picking here what they do. Do you know any resources or any work that's being done on that front?
Yeah, it's a very important messaging frame is what we call it. It is that gender affirming care is not just for trans and non-binary people. It also affirms cisgender people. I think of everything from breast augmentation to Viagra to hair implants to that new surgical fad to give cisgender, mostly men, a few inches to their height by literally breaking and expanding their shins. Those are all things that are considered gender affirming care. Even buying a big pickup truck is like gender affirming care in some ways, like it's really interesting. So I would say that a lot of these like messaging frames are being put into our conversations, both like in litigative strategy and state level legislative strategy. But it is really helpful for health professionals to use their own expertise and to make sure that people understand that that is the case. And so where I don't have like a resource doing those like sort of one-to-one comparisons, I do know a lot of journalists who are framing it those ways, and also a lot of journalists who've started to cover the fact that the vast majority of gender affirming care, we're not even talking about, some cisgender people utilize these services. I'm talking 95% of gender affirming care is for cisgender people. And same for gender affirming care treatments and practice for minors, like puberty pausers and hormones. Those are most of the time used by cisgender young people and also cisgender older adults when we're talking about hormone replacements. So I think that there are a few different waves, a few different journalists and a few different policy shops who are using that sort of framing. And it's very important to continue to do that. But my biggest note of caution right now is like you pointed out this like hypocrisy. It's really, really hard to put forth a logical, like sound evidence-based argument when it's being met with outright lies or mis and disinformation. So it's really important to not waste time on these individuals who are hell-bent on using the federal government and state level governments to target our communities, and instead to be talking to the people who are in what we call the movable middle, the folks who haven't really understood what's going on very much. They maybe think Trump is going too far in certain ways, but they don't really understand who trans and non-binary people are. They haven't met anyone who identifies that way. Talking to them from your own personal professional experience is the way that we can actually make change. So that means like sometimes ignoring the bots on Facebook and not arguing with them, but actively engaging the people in your direct network and your family, and taking up some of those hard conversations over like the Thanksgiving dinner table, just to make sure that you're reaching the people that your expertise can really change their mind. Because we can't keep wasting our time talking to the architects of Project 2025. Their goal is not preserving the patient and provider relationship, or even preserving medical integrity whatsoever. Their goal is to consolidate power among a very, very few select individuals. So as much as I'm like, yeah, of course, there's so much hypocrisy running amok, but it is very purposeful. And in trying to engage with it and dismantle it among one audience is not going to work. We have to work with like the very specific middle, movable middle that is still working to kind of grasp these concepts.
Thank you so much. I think we have a little bit of time left, so I want to see if there are any other questions for Alex, or if folks want to bring up anything for conversation, any questions you have. While we're waiting, while you're marinating on the brilliant questions you're going to ask, Alex, I can also ask, is there I know you mentioned that the GLMA conference is coming up in October, which is great. And of course, we want to encourage folks to become both CHESS members and GLMA members. Do both, please. But are there some ways or opportunities that you could point people toward if they're looking to expand their own knowledge or awareness, of some of the things that you briefly touched on today? Because it's a spectrum, right? You have to keep learning and growing. So are there additional resources that you might encourage folks either to sort of consume themselves or to share with their colleagues?
Yeah, absolutely. Well, I'm going to drop in the chat just now because there's a few different ways to engage, either becoming a member or even signing up for our newsletter just to learn more about what we're about. Like that's how a lot of our action alerts for advocacy opportunities are there. So definitely get involved and get in the know with GLMA. And you can see our newsletter. I think it's just at the bottom there, or signing up as a member. And also, yes, attending our conference and also supporting the work of some of our partners in this space. So we work really closely with state level advocacy groups, like everyone from Equality California to Equality Florida and everyone in between. Most states have a state level LGBTQ plus advocacy group. Getting involved with them, as well as LGBTQ plus community centers in your community, can be a really powerful way to kind of like plug in and continue to expand your knowledge and understanding there. But again, I think one of the best parts about becoming a GLMA member, and I'm sure as well as a CHESS member, is the opportunity for more CME that you're able to attain. And again, we offer free on-demand CME that is almost limitless in terms of like developing your own LGBTQ plus cultural competency. So there's a really important resource there. And also it's one of the first ever platforms to provide a more like tangible or objective scoring system so that you can actually see how you and your knowledge like stacks up.
That's great. Thank you so much. Folks, have any other questions, things that came up in your minds? Totally okay. If not, we won't keep you too long. Okay. Well, on behalf of CHESS, right, and of course, Adam, our vice chair of the LGBTQ Steering Committee, we are so grateful. Alex, thank you so much for being with us here today. As Alex shared, GLMA's conference or meeting is October 9th through 11th, and then the CHESS annual meeting is the following weekend, right, the 19th through the 21st. So you can go to Minneapolis, hang out with Alex and GLMA, then come to Chicago, hang out with us at CHESS. We would love to see you. And again, if you are not a member of our LGBTQ plus interest group, the link is in the chat. We'd love to have you sign up so you can get all the updates, hear all the cool stuff that Adam, Mauricio, and the other steering committee members are doing. And then you can sign up to be a GLMA member and you'll just get the best of both worlds. So on behalf of CHESS, Alex, thank you so much for your time. We really appreciate it. Adam, is there anything else that you wanted to add before we close out today?
I just want to thank everybody for taking the time to join us. I want to make sure that we continue moving forward in the spirit of solidarity, lifting each other up. We have always said that representation matters. And so showing up for events such as these, listening and putting forth the information that Alex shared with us and living within that information, living in within that solidarity, living in within those principles will help us all move forward. I wish everybody a lot of peace and a lot of strength.
Thank you all so much for having me. I really appreciate it. And thanks for being with me through these unprecedented technological challenges. Really appreciate y'all. And please feel free to reach out if there's anything else that we can be helpful with. Have a great rest of your week, all.
Thanks, everybody. Bye-bye.